Y'all need to grab y'all kids, get y'all mama, and go to Mars. Let me tell you why. It's a new virus. It's a new strain. It's an old virus, but it's a new strain of Ebola virus. Okay? The universe is giving you guys all signs because we all know we're going to be holding a World Cup in America in a couple of months in Atlanta, Georgia, right? In a couple of weeks. Okay, so let me tell y'all, this new strain is nothing to play with. 65 is already dead. Over 300 people got that stuff. Africans got it in Africa, and they are traveling abroad and they coming here because you know them Africans going to be coming here for the World Cup and all that. And honey, this stuff is going to spread. Now, they said that 3 days you're going to have it and you ain't going to know that you're dying. And then next thing you know, pow, you're dead. And it's contagious really, really quickly. And we already got a hantavirus. And hantavirus, they say, when you're doing it, it's almost like a transmitted disease because if you do it with somebody, they said the hantavirus stays in a man's nuts for a long, long time. Okay, so honey, this is worse than the HIV. The hantavirus and Ebola is worse than HIV. HIV take you 10 years to probably knock you out. The Ebola, oh, that's 3 days. That's 3 days. And a hantavirus, 2 months, honey, and you're a goner. But I got the real people that's going to speak out about it, so let's react to it. Make sure you guys like, share, subscribe here at Deep NOIR News, where I'm going to give you guys all the information. Honey, put your mask on, stay indoors, and close your legs because the world is coming to an end, y'all. They prophesize about this. The world is coming to an end. Check this out. I tell you no lies.
First, it was the hantavirus outbreak. Now we have a new outbreak of Ebola in a remote province in Congo, the Ituri Province. And the Africa Centers of Disease Control and Prevention says there has been 246 suspected cases with 65 recorded deaths so far. Why this is so serious is because Ebola has a 50% death rate. And this strain is not the known strain from that region they have seen before, which is the Ebola Zaire strain. This seems to be a different strain. They're not detecting it as the Zaire strain from preliminary lab testing right now. So this could be a new strain of Ebola. The vaccine that is available right now, the Ervebo Ebola vaccine, only covers the Zaire strain of Ebola. So they have no protection for this if this is a new strain of this virus. And right now there's only roughly 2,000 doses of the vaccine available in Congo. The Africa CDC expects to have results confirming the strain of this Ebola virus within the next 24 hours. So hopefully we will know more about this here soon. So be sure to check back for updates. We hope to know more. Comment, like, share, spread the word, follow, subscribe. There is no threat to anyone at this moment in the United States or around the world as of now. They think it is contained within the Congo. I'll see you back here for the 411.
It's May 15th. Today's outbreak isn't hantavirus, it's Ebola. As far as hantavirus is concerned, those cases all remain to those individuals who were aboard that ship. Ebola, however, has raised its ugly head again. 65 confirmed deaths, over 240 individuals infected, and the virus strain that has been sequenced is not the same as the virus strain for which we have a vaccine against. Now, many of you may not remember the Ebola outbreak that occurred under the Obama administration, but during that time we had much greater funding for World Health Organizations. CDC immediately sent teams over to the Congo at that time, put up hospital tents, contained the virus. We were actually prepared at that time in the United States to see Ebola on our shores. Every hospital, including the one where I was chairman of surgery, was getting prepared to have Ebola come to the United States. And we had rooms ready for them. We have nothing planned as that now, and this outbreak is actually getting larger. Public health matters. This is not a political statement. The virus doesn't care what your politics are. But when we cut funding for WHO, when we cut funding for Ebola research, when we cut funding for Ebola funding, when we cut funding for Ebola vaccinations, we're just waiting for the next pandemic. And I can guarantee you this about the next pandemic. It will not look like the last one. We need to continue increasing funding for vaccine research for Ebola, WHO, and early interventions to contain this deadly virus. We'll keep you updated. I'm Dr. Simpson. If you like this information, give me a follow.
An Ebola outbreak has been declared in the Democratic Republic of Congo in the Ituri Province. At least 246 cases have been confirmed and 65 people have died, according to Africa's top public health agency. Ebola is a deadly viral disease which is spread through direct contact with bodily fluid. It starts off with flu-like symptoms which can rapidly progress to severe bleeding, brain inflammation and organ failure. The virus was first found in the nation now known as the DRC in 1976, and this is the 17th outbreak since then. More than 14,000 people have died from Ebola in different African countries. The DRC and global partners are meeting to discuss cross-border surveillance and response efforts.
A new outbreak to tell you about today. Africa's CDC, the continent's top public health body, has confirmed a new Ebola outbreak in a remote Congo province with 246 suspected cases and 65 deaths recorded so far. 4 deaths have been reported among laboratory-confirmed cases. Suspected cases have also been reported pending confirmation. That's according to the health agency. Now, the Ebola virus is highly contagious and can be contracted through bodily fluids such as vomit, blood, or semen. The disease, it causes a rare but severe and often fatal situation. The latest outbreak comes around 5 months after Congo's last Ebola outbreak, which was declared over after 43 deaths. The new outbreak is the country's 17th since the disease first emerged in Congo in 1976.